there, it's Linda from Spasm Osteopath again, and today I'm going to show you how to try to ease out a back spasm. Okay, so if your back has just gone into spasm, it's very difficult to move, very painful, you're stuck and maybe lopsided over to one side. So these few exercises can be a nice way to gently ease the pain and gently try and get the muscles to get to a normal tone again. So Harry is lying on his back with his knees bent. Okay, settle into the position first. Start by being generally pain-free if you can. Okay, so nice and relaxed. Important to breathe while you're doing these exercises. And we're going to start the exercises by, if you just widen your knees a little bit, Harry, just to relax the thighs off a bit. We're going to start with some pelvic tilts. So pelvic tilts very gently articulate the back, the lower back, the spine and the hips. Okay, so Harry, if you can just take a breath in to prepare. As you breathe out, if you bring your pelvis towards you to flatten the lower back into the bed. I'm just going to get you to move your hands up here so we can see a bit better. That's lovely. And then if you can release that pelvis into its more neutral position again. Just releasing the hips forward. Lovely. So it's a really small movement. Take a breath in. As you breathe out, north tilt the pelvis again to flatten the lower back into the bed. That's lovely. And continue. So come through to your neutral. So the first couple might be quite twingy, might be a little bit sore, but this shouldn't damage anything. So we just expect it to be a little bit sore, but after the first few it should just ease off. Okay, a couple more, lovely, and then release into your neutral. So that's pelvic tilts. So do them until you feel a change. The next one will be single knee hugs. So Harry, if you just very carefully, so with control, keep the head and the breastbone nice and relaxed. We're going to gently take the left knee up towards the chest and bring the knee into the chest for a knee hug. Now, again, the first few might be a bit uncomfortable, but just slowly ease into it, keeping the head relaxed and remembering to breathe. And Harry, if you just bring your knee towards you and then away and towards and away. Really gently, no big movements, no big stretches. Okay? Aiming to calm the back down. Okay, good, take a breath. As you breathe out, float the foot back down again with full control, taking it really slowly. So you would do that on both sides. Now we're going to do some gentle rocking of the knees from side to side to try and put a little bit of rotation into the back. So Harry, if you just gently bring your feet together, and Nicola, if you can come round to the front here, just so we can see what the knees do. Lovely, that's great. And then really slowly and gently and minimally rock your knees over to one side and then the other. And allow it to move. If you're aware of any tension in your back or hips, breathe the tension out. Allow it to release. This isn't going to damage anything, it might just be twingy. And once this becomes quite easy and pain-free, you can go a little bit bigger with the movements. Okay, and once you're much better, you can bring the knees all the way down and all the way over to the other side, just to gently ease out any inflammation or back muscle spasm. So give them a go and give us a call if it doesn't settle down in 2 days. Okay? Take care. I'll see you next time.